It is important that all patients complete an initial assessment form before their first visit. This ensures that we have an adequate data trail through their treatment care, and also make sure that the database overall for the practice is accurate and reflects the way the clinic is performing. There are several different reasons that patients may not complete an assessment form that's been sent to them by email. Possibly the email hasn't arrived because we have an incorrect email address, or possibly the patient has forgotten to check their messages. The way we would follow up an assessment that's been sent out is to go into our work list, either by clicking on the work list button or use the work list tab. I'm logging in here as a receptionist, and what we're seeing here is under assessments not completed that an assessment has been sent to a patient called Freddie Smith, and we know it's a pre-visit initial assessment because it says initial here. The first appointment date is on the 26th of the 7th. The assessment was created on the 24th. They were last sent an email on the 24th. So say for example we're now the evening the 25th is the day before their appointment, or maybe a few hours before their appointment's due, and we actually need to make sure this information is collected. What we could do is actually contact the patient, and we see their telephone number there, and discuss with them why they haven't completed the form. Maybe they haven't looked and they're going to do it, or maybe the form hasn't arrived. What you can do from here, if you like, is you can resend the initial assessment by email by clicking on the button here. It says sent successfully, which is good. The emails are stored in a batch, and they're all posted out at about 15-minute intervals, so it won't necessarily leave for the patient straight away, but in the next 15-20 minutes it should certainly arrive in the patient's email inbox. Alternatively, if for some reason it doesn't look like the patient's going to be able to complete the form, it's appropriate to ask them to arrive at the practice 5 to 10 minutes earlier to complete the assessment form in reception before they see their practitioner.